Okay everyone, so what I'm going to do in this video is just go through and highlight all of the major features of the skull. Okay, so let me get a little comfortable here and we'll begin by identifying all of the bones of the skull, and then from there we'll start talking about each of the individual features of the skull. Okay, so let's begin by talking about the bones on this. So I'm going to go a little bit out of order from your list. Okay, I'm just going to kind of highlight the features that are there and talk about each of the bones, and you can follow along by updating in your notes. Okay, all right, so here looking at the top portion of our skull, so again, we're looking at the most cranial portion of the cranium, right, is that we have this bone here on the anterior side. This is our frontal bone. Okay, as we move to the posterior side of the skull, you can see here that we're going to have a left and a right parietal bone. Okay, so if I hold it this way, right, here's our right side, here's our left side, okay, and the parietal bones, again, are on either side of the skull. Okay. As we move to the back of the skull, you're going to have this bone here. This bone on the back is our occipital bone. So again, remember there's a lambdoidal suture that separates that. Our occipital bone is here. We're next to the occipital portion of our cranium. Okay. As we move to the lateral sides of our skull, you can see here, this is our temporal bone. So again, flat with the projection that goes forward. As we move along this connection here, we get to the zygomatic bone. So again, a left and right one that form the cheekbones on your skull. Okay. And then those connect to the maxilla, which is up here at the front. Okay. As you move superior to the maxilla and a little bit anterior, we have these two bones that form the bridge of the nose. These are your left and right nasal bones. And then from there, if we go past this maxilla that's on either side of the nasal to this bone that's a little bit deeper into the eye socket, this bone right here, right, that's deep into the eye socket is the lacrimal bone. So it's this small kind of circular bone here. And this is where your tear duct goes in. So we call that the lacrimal bone. Okay, as we move from the maxilla down, you can see here at the top portion, as we go kind of deep into this nasal cavity, this area here, we have a bone that sticks out the top. This bone at the top is part of the ethmoid bone, which we'll get to when we start looking at bones from the inside of the cranium, but the ethmoid is here at the top, and that connects to this bone down here, which is the vomer bone. So the vomer bone's job is to split the nose into left and right parts. Okay, so again, here we have the right side of the nasal cavity, here's the left side. Okay, so again, down to the maxilla to this large bone here, which has the lower portion of your teeth, as well as your jaw and all of those features. This is the mandible. Okay. Mandible that's here. Okay, so let's look at some bones that are on the internal portion of your skull. So if I take off the cranium, we can identify a few more bones. Okay, the first bone that we can see up here is part of the frontal bone as we go along this edge here, right, which goes down to part of the parietal. That's not quite down all the way to the temporal bone. It's a little bit more inferior on that. Okay, but if we look here, we see this projection up here. This is actually the top portion of that bone that we saw on the inside of the nasal cavity. That is your ethmoid bone. Okay, so your ethmoid is sticking up here. Okay, as we go kind of more posterior, you can see that we have this bat-shaped kind of weird elongated bone here, right around this circle. Right, this bone right here is the sphenoid. Okay, so the sphenoid is part of this kind of internal structure that's here inside of the skull. Okay, as we continue down and look at other features on the skull. Another one of the bones that you need to know is on the posterior side here, and then, inferior side here that goes up to this portion. This is your palatine bone. So your palatine bone is like your hard palate at the roof of your mouth. Okay, so those are all the major bones that you guys are going to be identifying on the cranium. Let's start going through and identifying some of the features on the cranium. So again, I might go out of order from your list, but again, I'll cover where all of those things are. Okay, so let's begin by just starting with the cranium and the skull cap here and identifying these sutures or these lines that you're seeing on the cranium. So again, this is the anterior portion of the skull, right? The first suture that we get to as we move from anterior to posterior is you actually see this line that's going across, right, separating the skull into a front part and a back part. So we call this the frontal suture, like a frontal plane, or we can also call it the coronal suture because this is like where our crown is sitting. Okay, as we continue down, there's this sagittal suture that's dividing your left and right parietal bones. Okay, so right parietal over here, left parietal over here that we're separating by this line. As we continue to the posterior side, you can see on the posterior side there is the lambdoidal suture. So again, we continue with our sagittal suture, and then it kind of splits into a left and right, kind of going down different paths, right, forming this kind of triangular, kind of tripod-y looking shape, right? This is the lambdoidal suture here that's separating the occipital bone from your left and right, from your right parietal and your left parietal bones. Okay, so those are all your sutures that you're going to see in the skull. All right, as we continue to talk about other sutures, one of the sutures you have here that's flat on the side, that's between your temporal and parietal, is what we call the squamosal suture. So squamous being flat, the squamosal suture is really, really flat, and it's between your parietal and your temporal bones. Okay, let's start identifying some other features on the inferior side of the skull. So let's start at the bottom and work our way around. Okay, so the first two features that you need to identify are these two foramen on either side here. So they're very lateral. So left and right foramen, which is known as your foramen ovale. They're called foramen ovale because they're oval shaped. Okay. As we move here to the center portion, we have these two projections that are actually what's your vertebra sit on. And those vertebra sit on these occipital condyles. So this is where, like with any condyle where you have articulation between two bones, this is where we're having an articulation between the skull and your vertebra. Okay. All right. If you look here in the center, you can see this large hole. This large hole here that's intermediate to your left and right occipital condyles is known as your foramen magnum. So this is where your spinal cord is going through. Okay. If we continue on this inferior side, another feature that you can see, which will require me to remove the mandible, is you can see there's this indentation that's on this side of the skull, which is known as the mandibular fossa. So a mandibular fossa, like any fossa, is a place where you have an indentation, and usually there's another articulation or bone here. So in this case, you have your mandible that sits into this joint. Okay, it's one of the joints that we have here. Okay. As we continue to move posterior, we have what is known as our external auditory meatus. So the external auditory meatus, if I say put this pipe cleaner in it, right, is a pathway through which your ear canal is going, right? So as we listen to something, sound waves reverberate through that and go down to the brain. Okay, this right here, this external auditory meatus, means that's on the outside, external, auditory meaning ear, and meatus is a canal or hole. So again, this is where your ear canal is. Okay. If we continue posterior, you can see this mass that's between, so here's the fossa, here's the external auditory meatus. This mass right here we call the mastoid process. So if we look on the anterior side, you can see there's a left and a right, so there's one on each side of the skull. Okay, and the mastoid process is called that because it looks like a mass, right? It's kind of mass shape, and it's this massive growth on the posterior side of your skull. Okay, as we continue looking in and going to other portions, you can see here we've got some spines. These spines are known as the spinous process of the skull. Okay, as we continue to go through some other features, right, on the posterior side, where you can go to this area here and you can see this bump. This bump here represents what's known as the external occipital protuberance. So again, this is a projection on the posterior side. It's just kind of bump on the back of your head, right? And some people's are bigger or smaller, but that's going to be the occipital bone. And again, it's going to be posterior and it's going to be medial. So it's going to be right on that sagittal plane. All right, let's continue to look at some other features. So here on our zygomatic bone, right up here, you can see that the zygomatic is connecting to the temporal bone here. So this is one of the trickier features that you'll see, but you can notice there's a suture right here. So what you have here on your temporal bone is what we call the zygomatic process. So what that's going to do is actually stick out and it's going to connect to this process here, which is known as the temporal process of the zygomatic bone. So on the temporal bone, you have the zygomatic process. On the zygomatic bone, you have the temporal process. And it's called that because those things are essentially connecting and going in either direction from there. Okay. If we move forward to the eye socket, okay, so let's look at features that are here. So the first thing that you can see is like this hole in the very back of the skull. Okay, so if I take my pipe cleaner and I shove it into the back of the eye, right, so that circular kind of hole that you see there, that's called our optic canal. This is where our optic nerve goes through. Okay, if you look on either side of the optic canal, you're going to see kind of these elongated paths here, one on the underside and one on the upper side of the skull. Okay, those are known as the fissures inside of the orbit. So you have an infraorbital, infra being below the orbit and supraorbital being above the orbit. Okay. All right, as we continue around the eye socket, there is a margin. So this is your supraorbital margin. This is where you kind of have that brow or like the upper portion of your eye socket. And you can actually feel that if you palpate it. All right, here you're going to have a little hole. This is going to be your supraorbital kind of impression here. So we call this our, I'm trying to think, did we actually identify it? We did. So our supraorbital foramen, what you need to know is being next to your supraorbital notch, so this space or area right here. Okay. As we move around some of the other features of your skull, you can see here is where your lacrimal bone is, and your lacrimal duct. We can look under there and we continue to the front, and you should see these two foramen here. So these two foramen are your infraorbital foramen. These are going to be holes that are going to be in the front portion of your skull that allow for, again, additional nerves to come through. Okay, let's move down to the mandible. Okay, so on the mandible, there are a few different features that you need to know. All right, the first here in the front, okay, we have what is known as the mental protuberance. So again, this is going to be kind of a projection on the part of your chin. To that, you're going to have these two foramen here. These are known as the mental foramen. Okay, these are two areas where nerves go through to your facial muscles and allow them to work. So again, you have the left and right here. If we look on the lateral portion of the mandible, you can see here we've got this kind of angle projection. This angle projection is known as a ramus. So this is the ramus of the mandible. So it's this whole projection that's sticking up. So on our mandible with the ramus, we have these two projections here. Okay, and in between those, there's a notch. So here's our mandibular notch, which is intermediate to the mandibular condyle. Okay, and what we call the coracoid process, or sorry, coronoid process of the mandible. So coronoid and your mandibular condyle. In between that is your mandibular notch. Okay. If we go to the posterior side of this, you can see that there are two more foramen that are on the ramus, that are on the posterior side of the ramus, and those foramen are known as the mandibular foramen. Okay, again, this is like where your dentist is shooting Novocaine into when they're doing drilling on your tooth. Okay, so those two things are going to be there. Okay, as we move to some other features that are on the internal portion of your skull, right? If we look on the inside, there are a couple things that I want you to be able to identify. The first is, if we look here, again, our foramen ovale from the inside of the skull, right? You can see that there's a center portion here where there's this kind of little divot or hole, right? This is what we call the sella turcica. This is actually going to allow us to hold our pituitary gland. Okay, another feature that you see here, so remember I was pointing out that projection or that point here, this is known as the crista galli. Okay, that's what the actual name of that is. And in between that, or on the either side of that, you're going to have these little indentations, which is known as the ethmoid, or on the ethmoid bone, which is called your cribriform plate. The cribriform plate is just where you have a ton of little holes that allow for exchange of nerves from your nasal area, from your olfactory nerves. Okay, the last thing here that I want you guys to be able to know is the nasal conchae, which are folds on the either side of your nasal cavity, which allow for kind of increased surface area inside of your nose, which helps us smell a little bit better. Okay. The last thing that I just want to make sure, again, I point out is the zygomatic arch. So again, just note that the zygomatic arch is made from the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. Okay. And our last thing that we're going to learn on the skull is, let me put this back together, is that here we have our frontal bone, but we have this kind of flattened area right here next to our supraorbital margin, right? That is called your glabella, right? So that is going to be kind of this flat front portion of your skull. Okay, so those are all the features on the skull. So if you've got questions, let me know.